What's up guys, did you tear your meniscus? We're going to go over the different types of treatment following a meniscus tear. My name is Dr. Marco Lopez, Doctor of Physical Therapy and Certified Strength and Conditioning Specialist and co-founder of the Basketball Doctors. So in this video, we're going to go over the different types of treatment for your meniscus tears. Alright guys, so let's just go a quick intro into what the meniscus is. So the meniscus is the cushion of the knee. It provides great shock absorption. It also provides joint congruity to make sure the joint's moving perfectly in that range of motion. So when it comes to meniscus tears, there's two types of meniscus tears. One, we have the traumatic, and two, we have the degenerative overuse injury. So the traumatic means there was a mechanism of injury. So those are the ones that you see in the basketball court when there's sometimes someone hits them or they twist, they pivot, sometimes they tear their ACL with their meniscus. It always involves some kind of twisting motion, also sometimes with some hyperextension motion, but there's some kind of event that led to your meniscus tear. And the first one's more common with the athlete, younger athlete, or even, professional athlete. And the second one is more with the older individual in their 40s, 50s, 60s, where it's wear and tear. And it's very funny sometimes that they'll go into the doctor's office, they'll get an MRI, and it's something not related for the meniscus, and they're like, oh yeah, you have a torn meniscus. Because a lot of times people have that meniscus degeneration over time from you just overloading it, and as just normal changes as you get older, and they won't have any symptoms. And they get an MRI for something unrelated, and they'll find out they have a meniscus tear. And there isn't one particular event. There might have been some events earlier on, but there was no symptoms with it. But just over time, you had that meniscus tear. And what are the main symptoms we're looking for when it comes to these tears? So the main ones that we're looking for, and that's going to be the mechanical locking and mechanical symptoms that I usually tell people. So we're looking for, does your knee lock up? Like, does it catch? Does it stop and you have to really move it around to get it? And the reason we ask that is because that's going to determine if you're going to have surgery or not. That's when it comes to our treatment. So when it comes to our treatment, we need to break it up to non-surgical and surgical. The non-surgical would benefit a lot from making sure we get the range of motion, get the strength and slowly get you back to sport. But it all comes down to if you have mechanical symptoms. Because if you have mechanical symptoms such as locking, the non-surgical would only go so far, and then you're going to need surgery if you have that locking. So that's the number one. So if you have locking, then you would most likely need to have surgery. And let's go over the surgical options. So there's three main surgeries. Well, there's two main ones and then one not as common, but we're going to go over them. So the first one is the most common one, is the meniscectomy. The meniscectomy is often referred to as a cleanup, where they just clean up the meniscus that is torn or that is locking, and they'll try to preserve as much meniscus as they can. So they're not going to remove your entire meniscus. They're just going to shave off and remove the part that is torn. And the reason is that if we remove the entire meniscus, that's just going to increase your risk for any cartilage injury. So they're going to try to preserve as much as they can, because that's going to give you cushion in your knee. Because if they remove it, the cushion goes down, and that increases our risk for any cartilage injuries and early onset of arthritis. So you want to preserve as much meniscus as you can, and that's why people do the meniscectomy. And when it comes to the rehab for the meniscectomy, it's a very quick procedure. Recovery time is pretty short, but long-term not so great, because like I mentioned guys, they'll remove part of the meniscus, so you lose part of that cushion there. The second type of surgery is the meniscus repair. So when it comes to the meniscus repair, it's a unique kind of tear, has to have good blood supply, and they'll tell you if they can repair it or not. When they repair it, they repair the torn meniscus, they'll sew it on there, and the good thing about this meniscus repair is that you maintain the integrity of your meniscus, so you're not removing the meniscus. However, when it comes to rehab, these recoveries are much longer, because a lot of the times you're non-weight bearing most of the time for anywhere between 2 to 8 weeks, depending on surgical preferences, meaning you can't put weight on it because we don't want to put any additional pressure on the meniscus that is being repaired. Great long-term, but short-term takes a little longer to recover. And you'll see this in the NBA. If anyone comes back from meniscus surgery within a month, they probably had a cleanup, a scope, a meniscectomy. If they take anywhere between 4 to 6 months, 8 months, that's more of a meniscus repair. The last one is the longest out of all, meniscus transplant. In the meniscus transplant, they get a cadaver, they put a meniscus in your knee, and that's because maybe you had too much damage in your meniscus, and that's a much longer recovery. I usually have seen people take longer in a meniscus transplant than a meniscus repair, But the meniscus transplant, some people that don't fit in the category for meniscus repair and they have a lot of meniscus damage, they'll opt in that meniscus transplant based on surgical preferences. But those are the three main surgical procedures. So we have the meniscectomy, the quick cleanup. So great short term, you're able to go back to your sport, everything quicker, but long term, not so great overall for your knee. Meniscus repair, early on, you have to do a lot of rehab, but great long term. Meniscus transplant, it just takes much longer for that recovery. And so that's the surgical options. The non-surgical, you just go by what impairments you have. So if you're lacking range of motion, we work on your range of motion, we work on your strength, we work on your movement, make sure we're strengthening the hip and ankle to offset the pressure there, because we want to now distribute the force through the foot and ankle and the hip complex to allow the knee to have less stress because that cushion is torn or is just worn down. So those are the key components when it comes to meniscus tear rehab, the treatment options. So to go over, you first got to find out if you have mechanical symptoms. If you have mechanical symptoms, then you're going to go into the bucket of most likely the surgical side, which is a meniscus repair, meniscectomy, meniscus transplant. If you don't have any mechanical symptoms, you're going to go into more of that non-surgical. And people talk about like, is my meniscus tear going to heal without surgery? Well, the reality is it's not going to heal itself. It's still going to be shown as torn in the MRI, but you might not have any symptoms. So people usually, a lot of the people have torn meniscus, but no symptoms at all. So don't worry about the meniscus being torn. As long as you don't have any symptoms and we're working on strengthening, you'll be in a good position. So hopefully you guys learned a little bit about what are the different treatment options are for a meniscus tear. If you have any questions, comment below, send us an email. If you want to work with us, if you have a meniscus tear, surgically or non-surgically, send us an email as well. We're located in Southern California and also work with individuals online. We are the Basketball Doctors. Let's ball for life.